When we present population health measures such as incidence and survival, we are often asked exactly where this information comes from. The following section goes over some of our main sources of cancer information. A lot of the work we do tracking cancer uses different types of health records. Records include hospital charts, lab test results, and death certificates. These records may be on paper, such as some hospital charts, or may be in the form of electronic files. Databases bring together health records from different people over many years. Our main source of cancer information is the Ontario Cancer Registry, or OCR. The OCR holds records of every newly diagnosed case of cancer in Ontario and every death from cancer in Ontario. It includes hospital and surgery reports, the results of tests done confirming that someone has cancer, and death certificates for people who died of cancer. Cancer Care Ontario has been given the responsibility of collecting this information under the Ontario Cancer Act and the Personal Health Information Act of Ontario. There are strict rules in place to protect the privacy of people's personal health information. The OCR provides us with a lot of useful information about cancer, but it doesn't give us all the information we need, especially those of us who study Indigenous health. One of the biggest missing pieces is the lack of race or ethnicity data. We don't know whether someone diagnosed with cancer who shows up in the OCR identifies as a member of an Indigenous group. We are also missing information about people's exposure to risk factors. The OCR doesn't include information about how people lived, so what they ate, whether they smoked, before getting cancer. The third major issue with the OCR is that we don't have a lot of information about where people lived during their lifetime. The registry only gives us the postal code for someone at the time they were diagnosed with cancer, not before. This means we don't have information about past exposure to local risk factors. For example, the OCR can't tell us if someone spent many years being exposed to something in the environment of a certain area, but later moved. Using postal codes to track location can also cause problems when we want to know more about people living in rural or remote areas. In a big city, such as Toronto or Ottawa, we can pinpoint the neighborhood where someone lives based on a postal code. But some postal codes in rural regions cover huge areas of land, making it much more difficult to figure out what community someone lives in. One of the ways we fill the OCR's gaps is by using record linkage. Record linkage is when we connect two databases by finding people who have records in both databases. Here's an example of how that works. Let's say we have one database that holds information about who has cancer, such as the OCR, and another database that holds a different type of information. By linking the two databases together, we can find some of the same people in these two different types of databases. By connecting records in different databases, we can find out new information about cancer in a population, such as how many people diagnosed with cancer are registered First Nation people. Collecting information about cancer risk factors, for example health behaviors, such as smoking or drinking alcohol in a population through surveys, is one way of predicting future cancer patterns. To do surveys, we select a sample of people from the population that we want to study. Our sample should be as similar as possible to the population that we want to learn more about. For example, around the same proportion of men and women, young and old people, urban and rural. Then data is collected from people in the sample using questionnaires, which may be done on paper, by phone, in person, or online. Here's an example of how surveys work. Let's say we want to learn about the health behaviors of a population, but there's no way we can speak to everyone in a population of 1 million people. Instead, we'll select a smaller sample of people, let's say 10,000, that is similar to the whole population as possible. Then we'll give our questionnaire to the sample of people. If we chose our sample well, the responses of the smaller group should be similar to those of the whole. Here's an example of real survey data. A question on the First Nations Regional Health Survey and the Canadian Community Health Survey asked teens whether they smoked cigarettes daily, occasionally, or not at all. From the responses to these surveys, we can figure out approximately what percentage of on-reserve First Nation, off-reserve First Nation, and non-Aboriginal teens currently smoke cigarettes. In this example, about 30% of First Nation teens living on reserve, 20% of First Nation teens living off reserve, and 7% of non-Aboriginal teens in Ontario smoked cigarettes. We encourage you to share this video and use pieces of the project in your own work. All we ask is that you credit the Aboriginal Cancer Control Unit by including this citation. For questions about these materials, or any other aspects of the project, please contact the ACCU by email.